Okay, so in this chapter, we'll be talking about the collection of blood samples. For the collection of blood samples, glass or plastic tubes are recommended. And to minimize breakage, please use appropriate storage racks. The gray top tube is the preferred collection container type for blood samples. The gray top tube contains two different preservatives, sodium fluoride and potassium oxalate. The sodium fluoride helps to stabilize drug concentrations and inhibits the growth of microbes that could cause in vitro alcohol formation. The potassium oxalate serves as an anticoagulant. If the blood sample must be stored frozen, long-term or even short-term, it is recommended that that blood sample be collected or placed into a disposable Pyrex culture tube. And the reason is that glass tubes may break upon thawing. So please use the disposable Pyrex culture tubes for long-term or short-term frozen storage. The container size should be optimized to minimize losses of volatile substances. So if the gray top tube can hold up to 10 milliliters worth of blood, you want to have enough blood in that tube to minimize the headspace over the sample. The sample should be stored in tightly sealed containers at low temperatures. Refrigerated storage is fine. After you collect the sample, you can store those samples refrigerated and keep them as such prior to submission to the laboratory for testing. We do recommend that 2 different blood tubes be collected. Ideally, a heart and peripheral sample should be collected. Heart blood could be used for screening purposes, and then a peripheral blood sample could be used for quantitative testing. If a heart and peripheral sample cannot be collected, we do recommend that 2 peripheral blood samples are collected.
This is Dr. Catanese, and I'll be talking about how to obtain various blood samples from different parts of the body during different procedures. The first thing I'll go into is central blood collection. This could be done during an external examination or a case where no autopsy is performed, or of course during an autopsy as well with internal examination. A central blood sample is one collected from the trunk of the body. Typically in an external examination, the blood would be aspirated from the subclavian region, where the individual would go down about halfway out from the midline following across the clavicle to a more lateral position, and insert the needle just below the clavicle, and pulling the needle back and forth into the trunk of the body would start to aspirate. And when the tip of the needle would enter into the blood vessel in that region, or the subclavian artery or vein, begin to aspirate, blood would start to fill up the syringe, and they would keep the needle in that position and continue to aspirate until they got as much blood as they needed. There is a risk with this kind of procedure that the blood may be, or the tip of the needle may be inserted into the trunk of the body, and you could aspirate fluid from the pleural cavities. So once again, I think it is classified as a blind stick, but that the probability of that happening is less than if you were to aspirate externally into the heart itself. As you take a large bore needle and try to aspirate blood from the heart or the aorta when the trunk is not open. You run the significant risk of inserting the needle too far and aspirating contents of the pleural cavities or the esophagus or the fluid in the pericardial sac, and this would change the results from a normal central blood collection. So you have to keep that in mind. In cases where there's criminality associated with the case, and the toxicology report will affect the court proceedings or the actual cause of death, this may become a considerable problem when you have to testify to a reasonable degree of medical certainty, not knowing exactly where the blood sample was collected. So in cases of criminality, particularly when testimony is going to be required, an internal examination should be done. In doing an internal examination and doing a central blood collection, it's a lot easier because you can visualize exactly where the needle is going or the sample is being taken from. In the pictures at the right side of the screen, it demonstrates the pericardial sac being opened and the heart being exposed, and visualization of the left ventricle where the blood is being aspirated in this case. You can also get central samples from the aorta, the inferior vena cava, from a number of large vessels in the body. As we stated earlier, it's important to document exactly where the blood sample was gotten from, because there could be different degrees of postmortem redistribution, and this would be necessary information for accurate interpretation of the results. The next slide demonstrates peripheral blood collection. Peripheral blood collection refers to the sample being obtained from the extremities. In an external examination, this would almost always be from the femoral region. Usually it's done where the needle is just inserted into the upper aspect of the thigh near the inguinal region. After the individual drawing the blood palpates the region and feels a crease between the muscles of this area, and the needle would be inserted into this crease. And this is an anatomic landmark where the blood vessels and the nerves will run from the trunk into the leg. Once the needle is inserted, it would be pushed in further while the syringe suction is being applied, and be extended deeper and then more superficial while the needle is moved either laterally or medially. And eventually the needle tip will end up in the blood vessel, where blood will be aspirated, and it will be visualized by blood being drawn into the plastic syringe. And when enough blood is obtained, you have your sample completed. As it's easier to succeed with this process in a very fresh body. If the body is as the postmortem interval increases, you get more blood clotting and dehydration of the body, and it's sometimes much harder to get a good sample. In different cases, people may palpate the leg in that area going to the periphery towards the ankle, and maybe break up any blood clots, and then elevate the ankle to have gravity help settle the blood from the outer part of the leg down into the thigh region. This whether the blood is drawn from the lower leg or the upper leg, it's still considered a peripheral blood sample. And it might be worth noting that's the technique you used for the toxicology report, just to be very thorough in explaining where the sample was gotten from. And sometimes incisions are made in the area, which it's often not really done, I think, because you want to be as least invasive as possible to the body. But if you can cut into the anterior thigh, it will make it very easy to visualize the vessels and make sure you're getting blood from this particular region, and it's a lot easier. Okay, the next slide just demonstrates how the leg could be elevated, and the needle is inserted in that indentation or crease within the anterior thigh where the vessels run, and then the blood is aspirated. The next slide talks a little bit about antemortem specimens. And antemortem specimens are very useful in cases where the individual doesn't die immediately. Like in certain circumstances, they might be a victim or suffer from an overdose, and then they live long enough so the blood is metabolized out of their body and then die several days later. So a usual postmortem sample is not going to show you what the offending agents were. So in cases of suspected overdose, the hospital, should actually put all of those specimens on hold. And that's why it's important to have a good communication with the emergency room in the hospital, so that the clinicians would realize this is an important thing to do. If the individual lives, they'll never end up in the ME's office, so those specimens may or may not be used, but for our purposes, to alert them of that fact. And then if they end up in the ICU and then suffer a fatality, we can do these tests on the antemortem specimens or the admitting bloods. It's important too, like sometimes people will die and due to trying to get the body expedited in certain religious cases. You might even be called to the hospital to draw blood or do an examination. And another thing that is very important to do, and this goes for postmortem blood samples, is you never want to aspirate a sample of blood from an intravascular catheter or any other indwelling catheter, because if an IV was set up to that line when the person passed away, that sample will be very different from what their regular blood would show, because of fluids and because medications are often injected that route. So I wouldn't even recommend taking a sample from a femoral region in the same leg where a femoral catheter is in place. You would use the other leg. In cases where there are catheters everywhere, you might want to consider doing an internal examination as well, and as an autopsy. Other things to keep in mind, I mean, when you're taking the specimens, even in cases of suspected delayed overdose where the admitting bloods are going to be very important, you never know. Sometimes people are given drugs in the hospital by family members. The drugs are snuck in, or you get those very rare cases where nurses or hospital workers will kill patients by giving them different drugs. And so in just because of those situations exist and you want to be thorough, I always take postmortem samples too, and you can keep them on hold and save them in the lab, for instance, until everything plays out about the case and all the information comes in through investigation, and determine whether those samples could be discarded at some point or if you need to do further testing. So, so I believe that's it for me. Thank you.
NMS Laboratories has a host of different test codes that can be ordered for each case. There are 3 postmortem panels. It includes the basic panel, the expanded panel, and the NMS total tox panel. The basic panel includes alcohol and screening for different drug and drug classes by immunoassay. We have an expanded panel that looks for the alcohol and several hundred different drug and drug metabolites by time of flight screening. And then we have the NMS total tox panel, which builds upon the expanded panel and includes even more drugs, such as the synthetic cannabinoids. We do have other test codes that are typically added on to a postmortem panel, such as panels that look for ketones in suspected cases of ketoacidosis. We have novel psychoactive substances panel and carboxyhemoglobin panel. So there's different test codes that can be ordered, and then on the different matrix types. I should note that vitreous chemistry is also available, and that tests for glucose, creatinine, and the electrolytes. There are some additional considerations regarding blood specimens. In terms of analyte stability, not all drugs are considered equivalent in terms of stability. So some substances, for example, such as LSD, are photosensitive and require light protection, or should be light protected. For light protection, it's recommended that the collection containers are wrapped in aluminum foil. You can look on the NMS Labs website or on the NMS Toxicology Sample Collection Guide to help you best select your test codes, the matrix types, and any recommendations in regard to how those samples should be stored. There are some instances where specialized testing outside of the gray top tube may require an alternate tube type. So for example, with heavy metal testing, the recommendation is to use a trace metal free royal blue top tube. And a prime example of the reason is with barium. We know gray top tubes contain barium. And if you have a suspected barium poisoning case and a blood sample is collected into a gray top tube, you are going to get back a very elevated barium result. And the analytical test can't differentiate between barium from the collection container and barium that was in the blood sample prior to death. So just be aware that there are some analytes that do require special collection containers. If a volatile or an inhalant such as difluoroethane is suspected, it is a good practice to fill any collection container up as much as possible to minimize any headspace that sits over the sample. Also, it's good practice to collect a dedicated blood collection container. So you just want to have a dedicated collection container set aside for inhalants and volatile testing, and then other collection containers for drug and alcohol testing. And that way it minimizes the opening and closing of a collection container, which can result in the loss of the volatile substances. And in cases where an autopsy is not performed, peripheral blood is preferred. And I know Dr. Catanese spoke about it, but you want to minimize potential for contamination with any type of blood sample that is collected, because it's from those blood concentrations that are analytically determined where the interpretation is going to come from.
For more information about this topic, visit nmslabs.com.